The coronavirus disease pandemic has had a terrible and long-lasting impact on the world. As the infection spreads, the projected mortality and economic devastation are unprecedented. From the pandemic's infancy, my team and I foresaw the challenges this virus would create for Blacks in particular. We published the first peer-reviewed paper on COVID-19 and the Black community, entitled The COVID-19 Pandemic, a call to action to identify and address racial and ethnic disparities. This paper was the first to provide definitive data showing higher rates of COVID-19 related infections and deaths in Blacks in America. According to the CDC, as of December 6, 2020, in total there have been over 20 million cases and over 365,000 deaths from the virus in the United States. A further dive into these numbers shows that our initial hypothesis has been unfortunately true. Blacks have suffered tremendously and disproportionately from this virus. The racial and ethnic disparities in the effects of COVID-19 are striking. According to APM Research Lab, Blacks are experiencing COVID-19 death tolls exceeding 1 in 800 nationally, while white Americans are experiencing death tolls at 1 in 3,125 nationally. Blacks have COVID-19 death rates of more than 2.7 times white Americans. Access to health information to educate the Black community on vaccines is key. Thus, I am here today to personally advocate for Black people to proceed with the vaccine. I've been a consultant for Johnson & Johnson, helping them with their vaccine work. Right now, that vaccine is not available, but the Pfizer and Moderna vaccines are available. I think we should obtain any vaccine that is available right now. I am getting the Pfizer vaccine. Today, I will receive my second dose of the Pfizer vaccine. I invite you to follow me through the process and the aftermath. Okay, I just had my second Pfizer shot. It's about 30 minutes afterwards, and I feel good. I don't feel dizzy, no soreness right now, although I think I'll probably get some soreness later. And we'll see how we do at the next stop in 24 hours. Racism and its subsequent effects on social and economic factors have resulted in the virus disproportionately affecting Black people. Our first peer-reviewed paper on COVID-19 stated that Blacks are disproportionately affected by poverty, mass incarceration, infant mortality, limited health care access, and health-related conditions, including heart disease, diabetes, stroke, kidney disease, respiratory illness, and the human immunodeficiency virus. We are also more likely to contract the virus and spread it within our communities because we are less likely to be able to work from home and physically distance ourselves due to living, working, and commuting. Again, all of these factors have historical roots in racism and segregation that have been consciously and unconsciously carried out for decades, and to this day, creating direct and indirect negative effects on Blacks. Given the fact that the virus has hit the Black community the hardest, I am concerned now that vaccine hesitancy may perpetuate the health disparities that we are currently seeing in the numbers of infections and deaths taking place. Most studies, for instance, at this point, have found Blacks as a community have the highest levels of individuals who state they will never get the vaccine or are not sure if they will get the vaccine. Many studies have noted that Black people cite distrust in the government and in the medical profession. Black people cite our nation's history of racism in medical research and in medical care as key reasons for their hesitancy. This mistrust is totally justified. Well, hello, I'm Dr. Cato Lorenzen, and this is now day one after my second shot of the Pfizer vaccine. I'm here with Dr. Neb Osman, my third-year orthopedic surgery resident, who is a STAR resident, who is a graduate of Mount Sinai, and also Jason Esdale, who is a fourth-year medical student who is spending a year with me doing research and seeing patients and being all that he can be. And so right now, how do I feel? I think that right now I've got some shoulder discomfort and shoulder pain. I would grade the pain after the injection right now, one day out, about 4 out of 10. If I move my shoulder about 20 degrees, I have no pain because my rotator cuff is firing. After I'm over 30 degrees, I move my shoulder and actually has pain because my deltoid is firing. It's sort of getting the physiology and sort of correlating with that. The important thing is I have had no chills, no fever, no muscle aches right now. I had some muscle aches after the first injection, but none after this. And so in general, I feel very good. And I'm here again, I'm seeing patients, and so today, so I must be feeling good. And overall, the results have been good. Again, I'm an advocate and supporter of vaccination for COVID-19. I think that everyone who has the opportunity should do it. And I'll be back with you tomorrow to talk to you about how I'm doing at that point. Well, hello. I'm Dr. Kay Lorenzen, the Van Dusen Professor of Orthopedic Surgery. Yesterday, I was in my clinic, at my clinical offices, seeing patients, and today I'm in my research laboratory, Lorenzen Laboratories, here at the University of Connecticut. As you remember, on Tuesday, 2 days ago, I actually had my second shot of the Pfizer COVID-19 vaccine, and I'm here to report how I'm doing. I'm joined today with two of my star postdoctoral fellows, Dr. Kenyatta Washington, who's on my left, and also Dr. Chinedu Ude, who's on my right. They're training with me in science, and we're pushing back the frontiers of science and making new discoveries every day at the Connecticut Convergence Institute. Well, at this point, again, we're now at day 2, and I'm continue to feel better. I slept on my right side, had my right shoulder injected, and I slept on my right side for the first time last night. And today, as you remember, yesterday I was able to move my arm to about 30 degrees, which meant I was firing mainly my rotator cuff. But now I'm able to go to about 90, 100 degrees in terms of moving my arm without that much discomfort. And that's a big improvement and big change from yesterday. No fevers, no chills, actually no rash. So I think I'm doing fairly well after day 2 of the vaccine injection. And again, I want to recommend to everyone, especially those in the Black community, to get the COVID-19 injection. It doesn't matter what company you use. There's obviously there's Pfizer, which is the one I received, and also Moderna. AstraZeneca will be coming out with one, and also Johnson & Johnson will be coming out with its vaccine. And so I think it's very, very important that we in the community proceed and get that vaccine. All right, well, take care, and I'll have one more update tomorrow at home. Bye-bye. Okay, I'm Dr. Kay Lorenzen. I'm the University Professor and Albert and Wilda Van Dusen Distinguished Endowed Professor of Orthopedic Surgery at the University of Connecticut. And this is now day 3 after having my second injection of the COVID-19 vaccine. I had the Pfizer COVID-19 vaccine. I'm joined on my immediate right by my very beautiful and intelligent wife, Cynthia Lorenzen, and then my far right, I'm joined by my very beautiful, intelligent, and super smart daughter, Victoria Lorenzen, who is a junior at Princeton University studying biology. So as you know, I had this is now day 3 since my vaccine injection, and I feel great. I was able to sleep on my right side yesterday without any problem. Had the injection on my right side, and now I have full motion of my shoulders, no pain whatsoever. So I've had no major side effects in terms of no rash, no fever, no chills, and no headache. And so again, I think this is something that everyone should take, particularly in the Black community. We've been hit so hard in terms of numbers of COVID cases, numbers of COVID-19 deaths, and particularly in terms of our community, we need to proceed. So I want to make sure it's very clear that I 100% recommend that we all get the COVID-19 vaccine when it's available to us. So take care.
Yes.
Bye-bye.